I'm talking to Helene Nguyen. She is from Feet and Beyond, and we are going to talk about minimally invasive foot and ankle surgery. But before we do that, let me welcome Helene to the program. Good morning, Helene.
Hi, good morning, Dave. Great to be here.
Well, thank you so much, and thank you for taking time out from what I know is a busy schedule. Before we begin, let's talk a little bit about Feet and Beyond. You've been there for how long?
We have been here in serving the community for almost 13 years.
Wow, that is really terrific. It really is. And our topic is minimally invasive foot and ankle surgery. So let's talk about what is MIS, as it's known, and what problems can it solve?
Right. Minimal invasive foot and ankle surgery is a surgical approach that equivalent to traditional surgery give equivalent outcome. The one thing that is less is that with open surgery sometimes require hardware, whereas minimally invasive is through very tiny portal and a skin incision, and there's no hardware on the patients when we do the surgery.
What type of surgery would be done where the patient could almost instantaneously walk out of the office, where the second type of surgery where the patient might have a recuperative or recuperation time?
Through the minimally invasive foot and ankle surgery, be able to correct most of foot and ankle deformity. Majority of the patients that I'm seeing and I'm using the procedure for is bunion and hamatoes, which is sometimes can be very debilitative to the patient with walking and affect their ambulations. So through this approach, I be able to give the patient the correction that's needed. Doesn't take a lot of time off from work, and patient can literally walk out the same day through a local anesthetic on the foot where we're going to be working on. So very minimal downtime for the patient, and the recovery time is definitely cut in half compared to traditional surgery.
And then would physical therapy be necessary?
Most of the time not. It depends on how severity of the patient's conditions. There are times that if the patient has been in problem for so long, most of the time the tendon muscle is compromised. So we may need to strengthen that after the surgery. It doesn't matter which approach we use. That's why we do want to give the community the knowledge of what is minimally invasive foot and ankle surgery is all about. You know, not all cases can be done through minimally invasive procedure. Obviously, that we'll talk about. Some patients may not get medically clear for sedation. Through this, I have many patients that be able to do that without any problem at all.
And it's done with what we call a local anesthetic, right?
Local anesthetic done at the office, so it's convenient for the patient. They don't need to be in the hospital or any facility to get this taken care of.
My guest is Helene Nguyen. She is a podiatrist at Feet and Beyond. And Helene, our time is running short, and there's a couple of other things I would like to cover. You perform most MIS cases right in your office on Mountain Avenue.
That's
right?
correct. That's a new service that we provide.
Okay, good. How can listeners schedule a free 15-minute consultation?
Very simple. Just give us a call, or you can visit us on our website. So our phone number is 908-576-0880, or you can go to our website, which is feetandbeyond.com. It's FEETNBEYOND.com. The phone number again is 908-576-0880.
Helene, very good. Also a video, right?
Yes.
That further explains the process. How can our listeners get that or have access to it?
Yes, we have a very comprehensive page that explains everything about minimally invasive surgery. I'm always available to talk.
Okay.
I can always talk.
Yes. All right. Well, Helene, we appreciate the fact that you came out and talked to us about this. Well, best wishes, and thank you so much for coming in. And, you know, there's a lot of folks out there that are suffering from foot problems that don't realize that by a simple surgical procedure, maybe that's able to be done right in your office, that they can have a life that is pain-free and feet that are pain-free.
That's our goal. We dedicate to foot health to the community.
Okay, and this one more time, give us the address.
Our office is on Mountain Avenue, right in the same building with IHOP and Fulton Bank. The address is 188 Mountain Avenue. That's in Hackettstown, New Jersey.
Okay, very good. Thank you so much.
Thank you so much, Dave.
Thank you. Helene Nguyen from Feet and Beyond. She's a podiatrist there. And I'm Dave Kelber. That's going to do it for this portion of the program.